More than 61,000 people are estimated to have died in Khartoum state during the first 14 months of Sudan's devastating war, according to a new report from researchers in Britain and Sudan. This staggering number includes roughly 26,000 violent deaths, a figure far higher than the current United Nations estimate for the entire country. However, the true death toll is likely much higher, with many deaths still uncounted, as the study suggests. Researchers indicate that, alongside violent fatalities, starvation and disease have become the primary causes of death, especially as the conflict intensifies.
My
brother Khalid was sick, and the war started, and this is a frontline area. There were no hospitals or pharmacies where we could get medicine, not even markets to buy food, which is essential to one's health. These were all factors which had an impact on Sanhuri until his body was frail and he got sick. We had no way to go and bury him at the closest official graveyard because it was very difficult to access such graveyards. So we buried him here, pointing to grave behind him. The best way to honor a dead person is to bury him.
The study, conducted by the London School of Hygiene and Tropical Medicine Sudan Research Group, provides a chilling look into the catastrophic effects of the war that erupted in April 2023 between the Sudanese army and the paramilitary Rapid Support Forces, RSF. The report finds that death rates in Khartoum state have been 50% higher than the national average before the war, as a humanitarian disaster unfolds in Sudan's capital.
It is difficult for someone to be buried in front of his house's door. His daughter cannot come and see this scene until now. It is difficult, but it is God's order and we cannot say anything, but it is very painful.
The ongoing conflict has displaced millions, with nearly half of Sudan's population, around 25 million people, now in urgent need of humanitarian assistance. Accurately recording deaths in Sudan has been a monumental challenge. Even in peacetime, many deaths go unregistered, and the war has cut off access to essential services, including hospitals, morgues, and cemeteries.
Most of those people died because of disease and starvation. They could not find food, drinks, or medicine. These people, RSF fighters, deprived us of everything. It was normal for them, RSF fighters, to prevent you from food and drinks or prevent you from leaving your home to get medical care. There was no one to offer medical care because we were trapped here. They, RSF fighters, trapped us and we are among them. I stayed among them for 3 months.
Repeated disruptions to internet services and telecommunications have further hindered the ability of families to report deaths or reach out for help. The study used an innovative Recapture method, previously applied to estimate deaths in the 2019 pro-democracy protests and during the COVID-19 pandemic, to estimate the number of fatalities.
We used to dig here and bury them. They did not let us get out of this area to go bury someone, get medical care, or bring food or even a drink of water.
The researchers gathered data from 3 independent sources: a public survey circulated via social media, data collected by local community activists, and obituaries posted online. Despite these efforts, the study concluded that the official toll was only a small fraction of the actual number of casualties, with the 3 lists covering only 5% of the total estimated deaths in Khartoum state. This suggests that the death toll across the country, especially in other conflict zones, could be far worse than previously thought. According to the researchers, the war's toll on health is not just from direct violence, but also from the collapse of healthcare systems and the rising prevalence of disease.
Given that Bari was one of the closed areas, there was severe lack of food in general, in vegetables, and the entry of aid into the area. This all impacted the nutrition of the citizens greatly and led to many cases of malnutrition. As we all know, malnutrition leads to weak immunity in general. This is one factor which led to exacerbating epidemics, which led to many deaths, especially among pregnant women and children.
Hospitals are overwhelmed with cases of malnutrition, malaria, cholera, and dengue fever. Food shortages, exacerbated by the ongoing fighting, have weakened people's immunity, making them more susceptible to infections.
In 1 week, in Al Samrab area, we had 144 people who died in only 1 week. Cases found in Bahri is not seen in any other location in Khartoum state.
We found that right across the country, the main cause of death was disease and starvation.
We found that right across the country, the main cause of death was disease and starvation. In specific conflict-severe settings like Jazeera, Khartoum, Kordofan, and Darfur, killings constituted the higher proportion of those deaths. So, amongst the people who were killed, who died, many more in those 4 areas were killed as opposed to have died of disease and starvation. What is of particular note is that in Kordofan and Darfur, the majority of people were killed, even when comparing to Jazeera and Khartoum. What we found specifically in terms of how many people have died in Khartoum state, we found that 62,000 people had died due to any cause. Among them, we estimate about 26,000 have been killed.
What we found specifically in terms of how many people have died in Khartoum, we found that 62,000 people had died due to any cause. Among them, we estimate about 26,000 have been killed.
Health experts warn that simple diseases are now killing many people, especially among vulnerable groups such as children and pregnant women. While the Sudanese government has reported significantly fewer deaths, its official tally stands at 5,565. A figure that is sharply at odds with the estimates of independent researchers and humanitarian organizations. Both the Sudanese army and the RSF have engaged in heavy fighting that has led to widespread displacement, destruction, and loss of life. The violence has been particularly devastating in the Darfur region, where ethnic-based attacks by the RSF have also been reported.
The numbers of the dead became really big. We bury at least 50 people per day. These are all fresh bodies. All are buried in 2024. These are all the bodies present now. These are all areas that we expanded to, including Kora Square, all these areas, as well as the Holy Quran University area, with large spaces as well.
The growing toll of death and suffering serves as a grim reminder of the urgent need for a ceasefire and a renewed effort to bring peace to Sudan.